Good afternoon, everybody. This is Rishabh here, and it's an honor and privilege to welcome everybody to celebrate the International Women's Day with the theme around accelerating action. As you see here, I have an esteemed panel with me. But before we go to the panel, a small little story to explain you why this is so personal to me and why this is so important to me. Let's get back to 1951. 1951, there was this African-American woman with the name of Henrietta Lacks. Henrietta Lacks. Anybody heard about her? Good, so my story is not out as of now. Okay, perfect. So this was a 31-year-old Afro-American woman who was constantly complaining of abdominal pain, bleeding, bouts of lymph node swellings, etc., etc. And she was visiting hospital. She was a mother of 5. Unable to get diagnosed with what was wrong. It was 1951, medicines were not so advanced, so it took a little time to figure out what was wrong with her. Eventually, she went to Johns Hopkins. Johns Hopkins, as we all know, is one of the state-of-the-art centers, and she was diagnosed at that time with cervical cancer. She underwent the treatment, what was available at that time. It wasn't as advanced as it is today, but there was a general practice at that point of time. When the patient was treated for cancer, the hospital would store a small amount of sample with them of the cancerous cells to be used at a later stage. Unlike other human cells, which have a limited lifespan and would die or would eventually run out of life in these hospital stored centers, there was something different happening with Henrietta's samples. What was happening was they were multiplying indefinitely. They were not just dying, which led to the formation of first immortal cell line, which is now popularly known as HeLa cells, H-E-L-A, HeLa cells, which have now today become a cornerstone in medical research. Now, what is the legacy of HeLa cells which we carry today? These HeLa cells, as we look back today, have been used for development of polio vaccine, in vitro fertilizations, HIV, AIDS, and even contributed to COVID-19 vaccinations. You know, Henrietta's family was also not aware about her contribution towards the world till about lately. And this is what Henrietta's cells did to us, did to the healthcare. But why am I telling this story and why does it matter to us today? You know, healthcare isn't just about science, it isn't about world-class R&D, it is about people, it is about the patients who trust the system, and the doctors who push the boundaries, and in the end, the generalists who bring these stories to life. Today, as we celebrate the International Women's Day, it's an honor, it's a privilege that we have 3 extraordinary, inspirational women with us, along with Manjira, who are going to be a part of the panel. It's an absolute honor to introduce Rupa Desai, who was a breast cancer survivor. Hello, ma'am, please. And now a filmmaker. We have Dr. Kiran, who just joined us, a gynecologist and obstetrician, who has dedicated her life to improving women's health. She's just coming from emergency surgery, so you can kind of imagine that how busy her schedule is. No problem, ma'am, no problem. And then we have Soumita, who is a generalist who ensures stories like Henrietta's are never hidden and come back, and she gets her due credit. As we start the program, and I'm not going to take further much time, but very, very thankful to all of you for finding out time and being here. The team is excited to hear from you, and so are we. But as we get into Women's Day, as we get into the celebration of International Women's Day, there are 4 things which we can take away and apply to our own lives. The first thing is accelerate innovation. Innovation not for us, for the women we serve, for the patients we serve, for the customers we serve. Amplify voices. You know, when we are in a room, always make sure that everybody has equity or everybody has a chance to speak out, and don't try to override just because you are a male, so to say, or somebody who is senior in the system. Make sure you are amplifying the voices of your colleagues around. Foster collaboration, which is one part of the accelerating action and the stronger together which we speak about. And the most important part is champion equity. If you feel somebody is not getting a just treatment, and I'm speaking this on the occasion of Women's Day, but this is in practice which we should follow every day. If somebody is not getting a chance to speak, be the person who gives that chance. Be the person who brings the other voices and unlocks the silent voices, as we say. So, without further ado, let me pass it on to Manjira to have that interaction with the panel we have. You guys hear from me on a regular basis, so I'm not going to take any further time. Thank you very much.
Thank you, Rishabh. Thank you.
Thank you.
So, yeah, we're starting at a little late, and I think Rishabh just explained why, but we have time, and I hope this will be a conversation which will be close to everyone's heart, because, what better way to accelerate action than to open a dialogue and hear from those who have been either practitioners or have experienced this in real life, or have data and insights to shed light on how can we shape women's health more meaningfully. I was reading this morning and something struck me that, health is not valued till sickness comes. And it seems to be much more truer of women. Just last week, ICMR cancer report has been unveiled, and we saw that the report presents a quite gloomy picture for cancer diagnosis and prevention in India. But what it also highlights is that women bear a disproportionate burden of this disease. So not to get on an alarming start, but Dr. Kolo, first of all, would you like some water, because you're just coming from there?
Fine,
okay.
I must apologize.
Not at all. Not
the
at all.
Topic pregnancy, you can't.
I know. I know.
Avoid. So I had an emergency.
I'll get into that. So without much ado, I first want to take a moment to introduce our panelists today and why do we have them? Because it would have been just easy to, get some other people who are much more closer to our business or who we do business with daily. So as Rishabh mentioned, we have Dr. Kiran Kolo. She's a renowned OBGYN. Many of you have seen her on television. And she has 3 decades of experience in women's health, specializing in high-risk pregnancies, infertility treatment, endoscopic surgeries. She holds 2 gold medals in OBGYN. She's also a faculty member at CMEST. She's affiliated with some very prestigious hospitals in Mumbai, Leelavati, Breach Candy, Hinduja. So warm welcome, Dr. Kolo.
Thank you so much.
We also have Shaumita Pal. Shaumita has decades of experience in reporting on healthcare trends, on public health. She has done, analysis on healthcare systems, policies, and the challenges faced by both patients and healthcare professionals. She has served as the assistant editor for healthcare at Hindustan Times, worked with Midday DNA, and currently she's a columnist contributing to these newspapers. And last but not the least, Rupa, my friend, thank you so much for being here. I don't want to give too much of an extended introduction. Rupa is an advertising and entertainment industry professional. She's a fitness enthusiast, as we can all see. She's a proud mother of 2, and she's got a fantastic story. And it's not a story of barriers or Rona Dhona. It's a story of the fantastic support and how it can help in getting a positive outcome from what could have turned out to be a disastrous diagnosis. So without sharing much more, I'm first going to jump to you, Dr. Coelho. A little bit behind the scenes. When I went to meet you a couple of weeks ago, I was telling you that why don't we get more patients to talk about what bothers them? How can we get, and women from so many stratas of society, and you said that they don't want to talk. So I'm just going to pick up on that. Is it something you see in elder women who don't want to talk about ailments pertaining to loss of fertility or whatever it is? Or is it a syndrome you see in younger women? Is it across the board? What are your thoughts on this?
Well, there's been a sea change. Of course, it's across the board because women at all ages have problems. Take an adolescent girl. She has her set of problems. In adolescence, you have menstrual irregularities, delayed menstruation. Then you have polycystic ovarian syndrome, which is as common as 1 in 3 adolescents in India, especially urban India. And then, of course, body image, bulimia, that sort of thing. Then you come to the reproductive age group. Young women, fertility is almost 50 to 60% subfertility in urban India today. It's that high because everyone's having their babies late. We used to tell our girls, please get married and have babies soon. They look at me, as if I'm from another planet because everyone's getting married at 30 and having their babies at 35, 38, and by the time you're 40, you have no eggs left. because women have a very short biological lifespan. We have the ideal age for childbearing is 18 to 25. Who gets married before 25? You know, so this is why pushing childbearing till little later is also a problem. So the problems of subfertility, then there are so many problems with menstrual irregularity, again PCOS in reproductive age group women, infertility. Then of course you have all the scares of maybe genital malignancies, you know, your pap smears, mammographies, early detection of cancer, and the fear of cancer. And then of course you come to the biggest thing which most women fear, and that is menopause. You know, so menopause is going to change my life. It's already so difficult. And then the post-menopause, and with menopause, all the problems of maybe hypothyroidism, hormone imbalance. You know, menopause strikes a woman at a time in her life when there are so many extraneous factors. Her husband has had his last promotion, sits at home, and now has taken her space. She has elderly parents to take care of. She has younger children who have flown the nest and now has an empty nest syndrome. Plus, she has her own problems where her body, you know, a woman in the prime of her life, I would say at 50, when she's just achieved everything in life, she's suddenly felled by menopause because the ovaries start producing less estrogen. And we are women because from head to toe we have estrogens. So we have estrogen receptors in our hair, teeth, heart, lungs, bones, everywhere. And suddenly everything starts going south because all our menopausal symptoms are due to estrogen deprivation. So then you have menopause, and then you have post-menopause and all the problems of osteoporosis, heart disease, etc. You know, until menopause, women have no risk of heart attacks. But after menopause, they have the same risk or equal risk of that of a man. So therefore, at every stage of a woman's life, she has problems. And yes, of course, now I'm practicing for more than 40 years. Initially, people were very reluctant to come forward. Women only looked after their husbands, their mothers, their children, and thought of themselves last. But now a little bit more openness. But I think it's more of, you know, I feel for women, they can't communicate because they think of themselves last. They are too busy with their children and they're, you know, looking after others' health rather than their own, number one. Number two, monetary factor. You know, to go for screening, to go for annual checkup, etc., costs money. In foreign countries, it's all covered by insurance. Fortunately, there's a trend that more and more women are going in for insurance. Abroad, you can't get your insurance unless you have your tests. And most companies, Roche included, and most of the multinationals do require you to go for your annual checkup, which is wonderful. And even if your spouse is in the company, then you go for your annual checkup. So these are the women who come forward, but not on your own. And that is where the rub is. And you know, we are talking about urban India. I practice in urban. What about rural India? In rural area, cancer cervix is the #1 killer. Cancer breast in the urban area. So therefore, women are reluctant to come and share their burdens because they are so scared that they'll be a burden on others. If they fall sick, what's going to happen to the family? If they have to go for cancer detection, and you know, it's like putting like an ostrich with your head in the sand. What you don't know won't trouble you. On the contrary, I tell every woman to be like an owl. You know, watchful, go for your annual checkup. I always say on Women's Day, please give yourself a birthday gift on your birthday. Go and have your annual checkup. And then for 1 year, you have peace and there are no last-minute surprises. Because as Roche will know, and everyone knows, every woman knows, you can conquer the big C cancer if only detected early. So first, primary prevention is prevent all the risk factors, know the risk factors, prevent the risk factors. Then second, go for early diagnosis, screening, and then when diagnosed, have the appropriate treatment. And definitely, you can get cancers young and live to survive and fight the big C. So these are the few points that I wanted to bring forward.
Thank you, thank you. Now, you're speaking from first-hand experience.
Absolutely.
Before I jump to Rupa, I'm just going to stay one more minute. You said in the urban centers, what you're saying is high prevalence of breast cancer. In the rural ones, cancer of the cervix, which is cervical cancer. And as anyone who's followed our brand on LinkedIn for years knows how committed we are to this.
Absolutely.
And yeah, I mean, can you just say that a little bit, your 2 lines on cervical cancer, it is preventable.
Absolutely.
The frequency of testing, the HPV test, what does it really do? Can you just shed some light on that, please?
Now, cancer of cervix, as we said, is the #1 killer in rural area, and India has one of the highest risks of cervical cancer, which is a totally preventable disease.
Preventable.
We know, completely prevent. In Western countries, you hardly ever see cervical cancer because of good screening programs. You see, we know now that 99% of cervical cancers are caused by the human papilloma virus, HPV virus, which is a sexually transmitted disease. Now, this HPV, when you have unprotected intercourse, the partner has HPV, the HPV virus, the high risk, there are hundreds of HPV viruses, but only the high risk ones, they change the DNA in the cervix. And 10 to 14 to 20 years later, this changed DNA then develops into cancer of the cervix. Therefore, it's entirely preventable. Number one, it's the only anti-cancer vaccine which is available in the world is the cervical cancer vaccine. Fortunately, we have the bivalent vaccine and the quadrivalent vaccine, which is, effective against all the high-risk HPV vaccines. So number one, good vaccination. Number two, early detection. And early detection could be, earlier we used to only rely on pap smears. So you have a pap smear, some of the cells from the cervix are taken and sent for papinocular stain. But we found that that was only 60% really to detect. Now we have a combination of both cervical cancer as well as HPV testing, and that is recommended for all women after the age of 20 or when they are sexually active right up to the age of 70. Once in 5 years if you do the HPV testing, co-testing, and once in every 3 years for the cervical cancer, then you can ensure that no woman will get cervical cancer. And number one, women in rural areas especially, and that's where your Roche self-test kit is so important. So women don't want to go to anyone and get themselves examined. Do you know that diaphragms have been a failure as a method of contraception in India, have been a total failure, whereas diaphragms, where you insert just at the time of intercourse, is one of the best methods of contraception. And why? Because we know that Indian women do not like to insert or touch their genitals, and that is a fact. And therefore, going for a pap smear test or an HPV testing, especially in rural area, is sort of taboo. So you have this wonderful self-testing kits where the woman can test herself for cervical cancer. And that, I think, we must thank Roche for that, because that was really innovative.
Thank you. And an opportunity to flex. Thank you so much, because the cervical cancer, Roche's cervical cancer self-sampling test is actually counted as, in 2024, one of Time's top innovations for 2024. So that was also a great moment. Rupa, I'm going to come to you, and as I said, your story is a story of positivity and shining light. If you want to just take us through your journey, what was your life like, and when you received the diagnosis, and immediately what timely medical attention, the right tests, how did they help you?
Thank you, Manjira, and thank you for having me. So, I have been a half marathon runner for several years now, and I thought, at the peak of my health when I was diagnosed. So the day of with breast cancer. So I had run 12 kilometers, I had also gone to the gym, and I had worked out, and honestly, I thought I'd never felt fitter. So when I walked in, it was a regular medical checkup. A lot of runners had been dying while running, and honestly, I went there only because I thought, heart-watt ka kuch dekh lete hain. So it was an entire package. I sauntered in with self-confidence. I mean, I knew nothing was wrong with me. I felt great. And you can imagine my shock when, at the ultrasound, I got to know that it was not 1, 2, 3, 4, or 5 lumps. I had 6 lumps in both my breasts. So I was asked to do a mammo, and I got my mammo done. And well, it did look serious. So I then had to do a biopsy. Of course, seeing a report of that sort can be life-changing and earth-shattering. Then I went in for a biopsy because that was the next logical thing to do. And a biopsy is, you go into the hospital, it's not a very elaborate or a long drawn out or a painful procedure at all. So I went into the hospital and they remove some tissue. And that tissue is then sent for multiple tests. As a layperson, we somehow don't know all this, but every cancer is different. So even people suffering from breast cancer have different types of cancers. So it is this test, this tissue that is sent for the testing, and it undergoes several types of tests, namely there's something to recognize ER and PR, your estrogen and progesterone levels, whether your cancer is hormone-driven. So mine was positive. And then there is something, some tests for HER2, whether it's HER2, negative or positive. So I was negative. So these findings impact your treatment. And, when you know all these details, or rather when the doctor knows all these details, he or she is able to carve out a tailor-made treatment for you. And that is what, this personalized treatment care or this path that the doctor, designs for you, creates for you, is what takes you towards your health and well-being. So, of course, as a person suffering from cancer, at that time, those were not things that mattered so much. I was more concerned about whether I was going to live, because it's considered like a death warrant. It still is considered that, despite numerous positive stories. But the first thing you feel is fear. So I did feel that. But as the treatment continued, I realized how crucial all these things were. There was another patient who was suffering, getting her treatment at the same time. And I was HER2 negative, she was HER2 positive, and her treatment was completely different from mine. The number of chemo she had, the dosage, the medicines that were injected into her, all of that was different from mine. And these are the findings which are there in your report, which determines your treatment, really. And the more you know, the better it is for you.
Thank you so much, Rupa. And when you were talking, even I was confused. I've been in the, you said ER and PR and HER2 and negative, and we, because we do work, we know. But I think what the point of the story is that it's okay if you don't know about all these terminologies, but the confidence that there is a possible cure, and which will only come when you go on time and get tested. And please do not doubt your clinicians. Yeah, don't say that the clinician is prescribing too many tests or too many medicines. Just trust them. It's a matter of life and death, and the pathway will open up. I think very close to what we do at Roche is personalized care, and that is the entire philosophy behind our work in neurology and oncology. That, like she said, no two cancers are same, and people often think that you have breast cancer, you will have mastectomy, you will have radiation, and you will have chemo, but no. It's the treatment pathways are very different. So thank you so much as a patient advocate for us for saying that. And I know you've been on CII forums, you've been on podcasts, you've been an advocate for that. I'm just going to transition to Soumita, you a little bit. And you've been writing on public health, particularly affecting women. Your recent story about menstrual hygiene sheds light on the crisis which is rural women face. During the COVID-19 pandemic, you reported that women faced significant health challenges, from disruptions in access to reproductive health services. As health systems are recovering, things are getting better, and we are reading about, particularly coming to cervical cancer, we are reading about its entry, including the vaccination and the immunization program. The NTAG has recommended the inclusion of the HPV vaccine. Is enough work being done on women's health? Is there an opportunity to do more? Are we too focused only on vaccination? What are your thoughts?
So this story that you were talking about, the menstrual hygiene challenges, it was about the menstrual hygiene challenges in that women face across age group. And it was more specific to rural population. And it was a NGO research work that they had done, research survey. And they found the reports were quite startling. Like significant amount of women still use cottons and rags, and they use it. The reuse of these cottons and rags are still prevalent. Also, women do not avoid medical help in rural areas because there is an absence of lady doctor. So, and they also found out that women would like to go for hysterectomy. That is to avoid since they don't have access to menstrual hygiene and other challenges like they feel weak during during the periods. So they will go for hysterectomy instead of because of all these reasons. Those things were there. So yes, while inclusion of HPV vaccine in national immunization program will be a significant advancement, but we also require policy shifts, which will include integrated digital healthcare, then community-based care, and also data-driven strategies. This will actually help every woman get access to comprehensive care that she deserves. So, yeah.
Thank you. And I think it's startling that they would rather go for a hysterectomy than bear the burden of regular periods. Dr. Coelho,
Just
yes.
add to it, it was wonderful, Samita, about the study which I read also. You see, the girls don't get educated in schools because of their they don't have money to buy pads. And then they use these rags which they wash and reuse. And therefore, they have very poor menstrual hygiene. They drop out of school. And the hysterectomy part of it is two ways. One is we have done a lot of surveys, especially in Andhra Pradesh, Kerala, and some in North India. They found that women under the age of 30 were having hysterectomies. Entire villages were having hysterectomies. Two reasons. One is menstrual hygiene, number one, may not be as much as cervical cancer. Because most of these areas, the men would come into the towns because there was no work in the village. And since they were separated from their families, they would visit prostitutes, they would get HPV, and they would carry the HPV to their wives, and their wives would get cervical cancer. And when one person in the village sees young women like them dying of cervical cancer, they would rush to the hospitals and get their uterus removed, thinking that there would be protection against cervical cancer.
But that won't help.
That won't help. And now the government of India, fortunately, and we are one of those, I'm one of those, we have a Save the Uterus program where no woman can undergo a hysterectomy under the age of 40 unless two gynecologists have said that it is necessary to save her life. So that we can stop this hysterectomy business all over India. And it is two things. One is cervical cancer, and of course is this menstrual hygiene. I used to be attached to this, just a few minutes.
Absolutely,
Spastic Society of India in Bombay,
Yes.
where I regularly, all the patients, Spastic Society is close to Leelavati, I'm head of department there, and all these young girls, because they couldn't manage, their parents couldn't manage, they used to come for hysterectomy, but now the government has stopped that. So we can't do hysterectomy on these young girls anymore.
So that's
because of that.
when did this regulation,
Some time ago,
That's
I know,
great.
Maybe about 5 or 6 years ago. But, we have no other alternative now. We may put in a Mirena or we give them hormones, but we can't do a hysterectomy. I mean, this is the other end of the spectrum.
Yes, this is the other end of the spectrum. And also, again, stemming from ignorance. Finding a shortcut, which is not really going to solve the problem.
Which is not really regular, because actually hysterectomy would do the mothers and these young girls a great deal of service.
Damage.
Because they're spastic, they can't handle their menstrual this thing. And also, you see, what happens is very often they get abused also. They may get pregnant also. So this is another thing. Anyway, that is a little away from
No,
you.
but that's
But
good,
this
and
is
that's
also,
yeah.
it's an
and-
aspect of women's.
Yeah, and you don't want the over medical care
Right.
to lead to abuse. You don't want that as well. But Dr. Coelho, you mentioned at the very beginning that the incidence of PCOS is almost 1 in 3.
Right.
What is so wrong in talking about it? It's a
Yeah.
disease like anything else. It will lead to insulin resistance. It will lead to what is the big shame? What is the big problem?
No, PCOS is actually, it's only PCOS, PCOD is only a hormone imbalance, And we are now we have done the survey, out of every 3 adolescents, 1 out of every 5 women in reproductive age group in India, especially urban India, not rural, has PCOS. And this is because that cyclical production of eggs ripening and then regressing and then the lining coming out is all hormone related. It's based on the diurnal variation of FSH, LH hormones from the brain and the ovaries. Now, this is totally disrupted in young girls. It starts with adolescence, where young girls in our day used to have PT, you have physical exercise, you move around and you don't put on weight. Now, all the young girls are sitting at their desks, they have their computers, they have to study, they have to compete, they have so much of stress. It's all stress related. There's an unhealthy cycle of, we don't know which comes first, the stick or the egg. But it's obesity, childhood obesity. You put on weight, you get, and because of that, the estrogen hormone, which is supposed to be at a certain level, which produces the egg, allows the egg to rupture, that estrogen hormone sits in the fat cells. So it never reaches the size, the level at which ovulation occurs. So every month the egg, instead of coming out of the ovary, starts sitting inside the ovary to form multiple unruptured eggs. These unruptured eggs then produce male hormones. So you have hair on the face, acne, pimples, and then you also have insulin resistance. So you start putting on more weight, and then after that you have irregular periods that leads to infertility, that leads to loss of body image, weight, so it's all a vicious cycle. And how do we treat is
How do you diagnose?
Diagnose, first of all, in different age groups. You can diagnose basically on the look of the person, the weight, increased BMI, then evidence of male hormones. That is, there is balding, hair loss, hair on the face, acne, pimples, and then you have these black spots called acanthosis, and you have irregular periods, and on sonography you have polycystic ovaries. So you have to have many of these factors to say that it is PCOS. The girls get irregular periods. So PCOS in young girls, what we do is always lifestyle change first. So even young girls, even older girls, first of all, you get a trainer, you go on a diet, you exercise, and very often, in spite of that, you still don't lose weight because of insulin resistance, and there are certain drugs which help with insulin resistance. So this combination. In a patient who has PCOS and infertility, then of course, we again regulate her cycles, we give her, because she's not ovulating on her own, so give her ovulation induction, and then get her pregnant. And then later on in life, then we see to it, because they are more prone to get diabetes mellitus and heart disease later on in life, and high blood pressure. So they have to be controlled. So it's a question of basically lifestyle change. That's the most important. Easier said than done. Today it took me so long in the traffic. I was getting stressed, keeping you all waiting. Because our lives are stressed. In our day, we had 7, 8 siblings. Everyone grew up. Now, if you have 1 or 2, or if you have a third, then you're the sperm king in the area. Because you can't bring up more than 1 or 2 children, not in, with their education and everything. So there's so much stress. There's stress in your day-to-day living. There's stressful cities, stressful lifestyle, so much competition for your children to get into good colleges. Not so in other countries as much as it is in India. Everyone is smart and everyone wants to get a good rank. Everyone wants to go to a good college, and it's so hard on the parents and the children. So there's stress in every. So basically, how do you then have a good lifestyle? No fast foods, proper diet, 6 hours of sleep, 30 minutes of aerobic exercise every day. And absolutely not. Especially, that's why I say, governments can help by highly taxing all the high sugar, fast foods, pizzas, colas. Parents are working, nuclear families, they don't want to sit and cook a traditional food. So you order pizza, you order this, order that. The children know everything. They just, the Swiggy, Zomato, whatever, they know everything, and everything comes to them. And what you're eating is all rubbish, actually. Dal, roti, chapati, sabzi is the best. And in fact, we are having all the trans fats in the world, and that again predisposes to PCOS.
Yeah, I'm really scared. I'm not going to take diet advice from you. But okay, yes, I totally agree with what Dr. Coelho, so lifestyle change, but also sometimes, what we've heard is women are struggling to get a proper diagnosis. And I know about the sonography which you mentioned. There's also this entire AMH test, which is a blood test, much more easier. Do you think it will just fasten the diagnosis a little bit more? Is it helpful?
Yeah, of course, AMH is very good. It tells you your egg reserve. That's a wonderful test. But this is for PCOS with infertility. So
Okay.
a girl, now I have so many girls who come to me for egg freezing. I do at least 3 egg freezings per week because every woman has now realized, oh gosh, we have a short biological lifespan.
So they're proactively coming?
Proactively.
The AMH test tells them.
Absolutely.
And,
AMH tells you, the AMH test will tell you exactly how many fertilizable eggs. You know, we are born with millions of eggs. But after the age of 30 to 35, the eggs ovulation is once in 2 months, 3 months. After the age of 35 to 38, I would say once in 6 months only you ovulate. And after the age of 40, your eggs are of no use. All the women you have heard of who are having their babies after 40 with IVF are all donor eggs, not your own. So therefore, we encourage young girls, if you feel that you're not going to get married and have babies by 35, 38, then please freeze your eggs by the time you're 25 to 32. So you have those frozen eggs and you can relax, have your career, and then have a baby maybe at 40 when you're ready to have a baby. And most companies in the United States, they pay their staff to get their eggs frozen so that they don't lose their stuff.
I think this is,
so this is
what you just shared is because
most important. And AMH will tell you. The
AMH
AMH
will
will
tell you.
predict. Now, if you have a good AMH at say 28, and you're saying anyway by 35 I'm going to have a baby, you need not go do egg freezing. But it's for those, and I have a lot of them. Those actresses, those who are working, those who are up the corporate ladder, and they just don't want to get pregnant. There are so many of them. So the double income, no kids, double income, 1 kid, double income, 2 kids is very, very unusual. So, we have lost, in urban India, we have lost joint family system. So
Yes.
this is one of the main
Big loss.
things. You are left alone with your husband, both working. You have to depend upon, we don't have good daycare facilities at all. Most companies abroad have wonderful daycare. We have to depend on buys who may not really take care of your kid. So then there's so much of stress. And women, I always say, we can't have it all. We may want to have it all, but we can't have it all. And so women, unfortunately for your health, I always say, reach out with both hands and grab every single opportunity to get yourself tested, to know that you're in good health, because unless you are in good health, you're not going to be in a position to help anyone else.
Yeah, as we say, be your own Shiro. Don't
Yeah.
wait for anyone. And I think beyond the test, beyond the freezing of eggs, I am also looking at it that it's a tremendously empowering test then, because if you are, as you said, climbing the corporate ladder, not ready to start a family at this moment, there is an option. Science has provided you with an option. Freeze your eggs, plan. So it's almost a lifestyle choice, I feel.
Absolutely.
But again, coming to Soumita, we are talking about urban women who have the privilege of choice. You have been a columnist. Do you think enough, are we carrying enough of those voices about the challenges which women face in rural areas? As a media professional, do you want to see more stories, and what is the nature of stories you would want to see?
Actually, when we talk about that, media is just not about news. Like, it also includes visual content. So we should be having more of these contents on breaking the taboos related to women health. Preventive, whether it is a preventive thing or a screening thing, all these things has to come in web series, movies. Social media has a lot of impact now. So yeah, like it's just not with the news thing, but also we have seen how Tare Zameen Pe had impacted. Like it brought awareness on autism, dyslexia. So with that thing, I think even visual content, etc. That part, social media part, also needs that sensitization can happen through these platforms too.
So rightly said. Rupa, you've also been involved in advocacy and you are, as I said, you're one of the few patient advocates who's agreed to speak. So, what stops patients from, do you think, coming forward? And what can people like you do to encourage more voices? Men as well.
I think this is my guess, that the journey is so hard when you're undergoing treatment. The journey is so hard that talking about it can bring back a lot of memories. It does happen to me. Every time I talk about it, it all comes back, gushing back to me. And often leaves me feeling teary, or, it brings back all the hard, the pain that one has gone through. So there may be reluctance because of that. There may also be other social reasons. They've not shared it with people. I know of people who've undergone treatment and not shared it at all with anyone else, so they don't want to come out and talk about it. That could be another reason. But like I was telling you earlier, I made a resolve that I will talk about it at every opportunity I get. Because when I was suffering and I wanted to, know a little bit more about what was the path ahead going to be like, I asked my doctor, and he asked a couple of his patients, and they all said no. So I really didn't have anyone to go to. And talking to people who are not walking the same path is very different, because they will say, no, everything is going to be okay, just be positive, everything's going to be okay. And you say, what the hell? I mean, yeah, I'd like everything to be okay, but you really don't know.
There are no guarantees.
There are no guarantees. Anyway, talking to somebody who's gone through it also, there is no guarantee. But at least it comes from a place of empathy, rather than, sometimes you think people are patronizing or they're being facetious. They're just saying something because they have to say, it sounds correct at that point of time. So then later I did meet a few very strong women who were a great help to me. And I decided that if I ever get an opportunity, I will definitely, no matter how hard it is, I will speak about it, because if it's giving them strength, and even if one person gets something out of my story, it's a story worth telling. So yeah, I definitely take that time out. And it's very gratifying, because a lot of people come back and have told me that, you held my hand through my journey, or you always inspired me. And that's great, because you need all the help when you're undergoing cancer treatment.
Absolutely. Before we wrap up the panel, and I think we'll just open it for 5 minutes for some questions or thoughts, reflections. Dr. Coelho, if I'll come to you, if there are 3 parameters which a woman should have at her fingertips, what would you recommend? We have a diverse host of women who are attending today, or on LinkedIn Live as well. Yeah.
I'll give you 3 points on 3 points.
Yes, please.
Okay?
Yes.
So the first is, you must know your blood pressure, your pulse rate, and your BMI. BMI is your body mass index, because this all should be within normal. Then second, your blood tests. You must know your hemoglobin, your blood sugar, your thyroid function, and your cholesterol. That's a must, because
All women?
All women, all women. Because for heart health, you need your cholesterol. Yeah. For your hemoglobin, all Indian women are anemia. And blood sugar, diabetes, we are the diabetes capital of the world. They're just like PCOS, diabetes also. So your blood sugars. And the third is all your prevention. Have you gone for your annual check? Have you had your pap smear, your HPV testing, your sonography, pelvic, and your mammogram? If not a breast self-examination, maybe a breast a physician's examination, maybe a sonomammogram, and after the age of 40, definitely once in 2 years, a breast a mammogram. And if you have a first degree relation, that is mother, sister, anyone, then in case every year. It's a must. And the whole family of those who have breast cancer, of course, there's only 10% genetic, but there is a genetic this thing. And more awareness should be there for breast cancer, I feel. As a gynecologist, every woman who enters my room, I do a breast examination, no matter what their age is. And you will be surprised how many lumps I've picked up. No one
just
thinks,
by a
just
simple
clinical examination, just because you've come for some gynec problem, but actually do a breast examination. I'm a teacher, I tell all my students, I tell all my doctors, please do breast examination. It is life-saving. I give talks on breast self-examination. After a period, how to examine your breasts, what to see, whether there's a lump. All lumps are not cancer, but most cancers start with a lump. You know that. And early detection is so important. Nowadays, there's been a sea change, as you said, individualized treatment is so wonderful. You don't have to remove the breast, you can just do a lumpectomy. You don't have to remove all the lymph nodes, you just do a sentinel node, you know, and you have targeted treatment, as you mentioned. Each patient, the entire history, and now we have AI-generated treatments for targeted treatment. You can go to Mayo Clinic, you can go to the best of hospitals abroad through AI generation and find out, is the chemotherapy that you are receiving for your type of cancer, is it commensurate with what is the protocol for the rest of the world? And then that gives you a great deal of this thing. And fortunately for us in Mumbai, we are cutting edge when it comes to oncology, gynecology, laparoscopy, robotic surgery. I mean, there's people abroad, in fact, they send their people here now to learn because we have the patient population.
Yes. Thank you. I mean, you've said a lot of tests. I was just keeping count. I think I have only about 4 of those statistics. So yes, lots of homework you've given us. Shamita, 3 things which you feel in policy systems or at the government level we need to focus on. Short words or sentences.
So I think, like we said, integrated digital health, then community-based care, and data-driven strategies, collecting and analyzing gender-specific health data. It will go a long way in identifying the gaps and target intervention more effectively. Also, through education, innovation, and advocacy, we break the barriers and prioritize women's unique health need. So, yeah.
I think that's, so dependence on data will only lead to real
So
science.
what we need is, from the government side, access, every woman should have access to quality and compassionate healthcare.
Perfect.
At every stage of life.
Every stage of life, yeah. You know, it's not, at every stage of life is the key sentiment here. And Rupa, from you, when I was thinking, didn't want to use the word breast cancer survivor. I mean, it's redundant. Of course, everybody's a survivor. We are women. So, but as someone who's undergone that journey, 3 things for anybody who's in a similar life stage, who's encountering, maybe not being able to talk about it, what do you want? 3 words of hope.
I would say, as women, we have a lot of resilience, forbearance, and fortitude within us. So if you're going through a hard time, dig deep into your reserves of mental and physical strength and you'll surprise yourself. You will find that you have it in you. Secondly, I would say that the only constant is change. If you're going through a bad time, it's going to change. Good times are waiting for you. There is light at the end of the tunnel. You will go through this bad time and you will come to a better time in life. And third, I would say it's very easy when you're going through a health crisis to get caught up in a vortex of negativity and despair. Allow yourself to be with people who fill you up with joy and optimism. Allow yourself a few good laughs, because at the end of the day, laughter is the best medicine.
Thank you so much. I mean, absolutely, couldn't agree with you more. Thank you so much, everyone, for joining us, because I believe that we've covered a lot of ground today, from the barriers that women face in accessing quality healthcare. We heard about, how an epidemic of hysterectomies is happening for something which is completely unrelated, about poor menstrual health. And I think these sort of exchanges highlights the power of storytelling, advocacy, and collective action in transforming women's health. Before I wrap up, I think we have just 5 minutes. Any questions from the audience? We are also, monitoring the live online session. So, but any questions or reflections from the audience who's here in person? Absolutely, we'll pass the mic. Yes, please. Do introduce yourself and then any... Please come. There's the camera.
Oh, I'll have to come that side. हेलो चल रही है Hi ma'am.
This is fine. Yes, go on.
Hi ma'am, I'm a perfect example of all the women that you just described. I have a history of PCOS. I am climbing up the corporate ladder and I definitely don't want to get married in the next few years.
3 cheers for that.
So, to come back, ma'am, I'm Dr. Praji. I hold a degree in head and neck pathology. So, ma'am, when I was diagnosed with PCOS in my mid-teens, that was during the time I was preparing for NEET, there was a lot of stress. I, of course, did not think about my health. My focus was on securing marks, and I was ignoring all the symptoms that I could. Okay, during the college years, everything I managed through it, and I sailed through that patch. But what I remember my gynecologist at that time telling me was that never disclose your PCOS diagnosis when you get married, or because it's related to infertility and other problems. But then what I realized is that our foundation of when we start empowering kids and women of what menstrual health is about and what these diseases can do, they should also start at school level. We are just told about, we have a sex ed class, we are told about our bodies are going through changes, we're going to start menstruating, life is going to be different. But there is still a lot of stigma attached to it. I still cannot sit with my dad and talk about, okay, this happened. It's still a hush-hush topic. So my question was that, how can we drive this change behaviorally, starting with our homes, starting with an individual? So just wanted to hear your
No,
thoughts
so
on that.
true. And your gynecologist was very old school to say don't share, because we always share now. You know, each couple should know exactly. And PCOS, if 1 out of every 3 girls has PCOS, that means no one is going to get married if they share. You understand? And not all PCOS girls are infertile. There are various aspects of PCOS. It's a syndrome where you may have regular periods, but you still got obese, you still have a hair growth. So there's a various spectrum. You may be on 0 of the spectrum, you may be on 10 of the spectrum. So it is multi-diagnostic. And I run a PCOS clinic, so I can tell you there is no stigma at all. Parents come, young girls come, infertile women come. And it is a group therapy. Number 1, you yourself should realize, okay, I have PCOS, I have to fight it. You yourself have to make changes in your diet, exercise, lifestyle, and it's doable. Give yourself that little me time, do meditation, yoga in the morning, it's possible. Climb stairs everywhere, it's possible. Little things. Walk to the station instead of taking a lift, possible. All these small things in your food. You need to have help in the form of, so you must have a nutritionist who will see what you're doing, and you should have access. Now you have online nutritionists who will take you in hand and tell you, if you go to a restaurant, you can just tell your nutritionist, I'm here and these are the choices, but you'll get everything in reply. Be aware of what you are, what you eat, even if you have PCOS. Exercise, and try to break the chain of this stress. And automatically things will fall in place.
Right, ma'am. So,
And of course, help of drugs. In the sense, you can get your periods regulated. There are many drugs now which are available which will help your hirsutism. You can have laser treatment. You can reduce your weight. And there are so many. Every woman today can have a baby, even if the husband has only 1 sperm and if you have only 1 egg. Even if you don't have that, you can still have one. With the help of assisted reproductive technology. So don't despair. There is help, and you must reach out for that help. And it's always a multi-specialty diagnosis, and it's a multi-specialist treatment also, with the nutritionist, with the exercise training, with the endocrinologist, with your gynecologist.
yes, ma'am. So I had that spell.
Yeah.
I crossed over.
Yeah.
Thankfully, things got resolved. My question was more from, there are doctors, there are patients who advocate for it, but
to inculcate that behavioral change, to bring that pattern, normalizing that thing with my brother or my father, at a familiar level, what I can do, or as an individual.
Yeah, that's where Somita and all come in, because we can have programs where we talk about PCOS, and to talk about schools, I go to a whole lot of schools and colleges and give talks on PCOS. So there are many gynecologists like me who will go at that extra step, because we know we are dealing with an epidemic. We are nowhere dealing with PCOS, and this is not a small thing, especially in urban India. So therefore, and I am so surprised that drugs are given to young girls from the age of 16, 17, 18 when they don't require it. So there is in all our conferences, be it the Fed National Conference, Regional Conference, PCOS is one topic which is always covered. We have a PCOS Society of India, of which I'm an active member, where we talk, we send brochures, booklets, educational material, which is kept outside our clinics for everyone to pick up and read. I think SNDT did a very nice program with me for their dietitian and PCOS program. And then they, again, spoke about it. So, you can always speak about it. PCOS it's like diabetes. Everyone has diabetes. They take medicine for it. It is a PCOS. We take medicine for it. Thank you.
Thank you, Prachi, for, again, being just bold enough. And I think, one form of answer is platform these voices, talk about these things. So as you said, you're not one of them, but probably the clinician who first counseled her when she was a young guy was fairly old school. And that needs to change if we have more people like you, if we have more people like Prachi asking these questions, nudging these conversations. And of course, Shomita, you do stories, you talk to doctors. We have more people like Rupa who will come forward and share their experiences and actually show that not everything is gloomy, that things do have.
Absolutely.
Thank you so much for sharing your time, your thoughts so generously. And thank you everyone who took out the time to join us. And we will see you again soon. Thank you so much.
Thank you.
Thank you, Manjari, for